Hi, welcome to Big Mama's Kitchen and Catering. We've moved to our new location here at the beautiful Highlander Accelerator building located at 30th and Patrick. We are still open even during the pandemic. We've made some changes and we are here to serve you Omaha's best soul food. The best way to order Big Mama's delicious soul food is to go to our website, bigmamaskitchen.com, click on the Order Now button, place your order, pay for your order, and upon arrival, park at any one of our 4 convenient curbside pickup locations. Give us a call and we'll bring the order right out to you. You can also order carryout from Big Mama's. Park on the Patchett Street side of the building, walk down this long brown sidewalk, and come in through the west doors. Once inside, you come in through the door and enter in what we call the dining room, and you walk right up to our window and you can place your order or pick up your food. We're looking forward to preparing a fresh home-cooked meal for you, and we hope to see you soon.
Oh, welcome everyone. My name is Willie. My name is Willie Hamilton, and we want to welcome you to the Hungry Club. Great information, great speakers, great food, great friends. Today we got special guests taking place, Mr. Phil Rooney, who works for the Department of Health, and we will be expecting Dr. Lindsey Huse, journalism. No, no problem. So Phil, tell me a bit about yourself, if you don't mind.
I worked in local media in town for probably 25 years, and during that time I also had about 4 years of experience working with Bob Armstrong at the Omaha Housing Authority, and I've been 15 years now at the health department doing public information work. That's what I did at the Housing Authority, and of course now when I was a reporter, I was doing much the same type of work I am now, except I was on the other side, so it's kind of nice to be chased instead of being the one doing the chasing.
Yeah. So are you still in that work on the side, working with journalism or writing stories?
Freelance article, not generally nothing related at all to what we're doing at work.
Okay. Well, look, we're getting ready to go back to school, and the kids and a lot of folks have questions regarding this pandemic that we seem like we're still in, if you will. We're still in it.
There is a little couple of at the end of the pandemic, so the pandemic is definitely still with us. And we have, I did see the numbers today, we have over 100 new cases, which is down from what we were seeing. We were having days of over 200 cases last week. So,
Turn the mic down.
oh. Is there some magic? I wasn't working on that. Okay.
Check. Thank you.
So do we have to go back and start over, or are we good to pick up where we left off?
Yeah, you might want to go back a little bit. We good?
Okay. Ask away, Willie. What were you going to say?
So, our kids are getting ready to go back to school, and it seemed like last couple of years been a spike in the COVID cases. So, what can we expect going into the school year this year?
Well, we are always talking to the schools. I know Dr. Huse meets regularly with the superintendents, and I think we have to be ready to expect anything. There probably will be new variants that come up. We can kind of expect that to happen. When people get together, that's when the disease is transmitted. People have to be ready to respond to whatever may be going on, but we're certainly going to start out looking a lot more like normal than we have before. They're not going to be any, okay, I have to be a little closer to the microphone. I don't think anybody's going to be doing masks to begin with, and it's probably unlikely that it'll happen during the school year. But there will be procedures to follow. We're asking people CDC guidelines. So if somebody tests positive, we'll want them to be out 5 days, and we'll want to keep an eye on the people around them to make sure that they monitor themselves for possible symptoms. We do have a good number of the kids over a certain 6 years old who have been vaccinated. And we now have the director coming here to take me out of the hot seat. Dr. Huse, please welcome. Welcome to the Hungry Club.
Now, if you want to stay up here, we can bring up another chair. Phil.
Sorry.
About school, no problem.
Oh, wonderful.
Hi.
Hi.
Yeah. So we were talking about school and how we're going to look this year. Will the kids have to wear masks? What age is comfortable for kids to be able to go get the vaccine? Can you talk a little bit about that?
Sure, absolutely. So at this point, we are following the CDC recommendations for schools. And so those CDC recommendations are widely available. They're similar to what they would have followed last year. So again, it's really going to be up to each district how they want to put in place different measures within their district. So it's really going to be a district by district decision what that looks like. So, masking may occur in some and not in others. It just depends. But the way the CDC guidelines are set up is that it follows those transmission levels. So if you look on our dashboard, you can see green, which is low transmission, yellow, which is moderate transmission, and then that kind of orangey red, which is high transmission. And then the guidelines kind of follow those transmission levels. So you would expect fewer things in place for that green level, and maybe some more layered on for that orange or red level.
So in Douglas County specifically, 68104, 68110, we're in a high level.
Yes.
What should we be doing to protect ourselves and our children?
Thank you. So vaccination still remains one of the very best ways to get people protected from COVID. I will say that we have a lot of COVID spreading in the community right now, but by and large, it seems like that a lot of the cases we're seeing are maybe less severe. And I think, the fact that we have so many people vaccinated right now with that. Right now, anybody over the age of 6 months is eligible for vaccination. So that is wonderful news. So those, appointments to have vaccinations done can be made. You can check our website. We have a schedule available that you can schedule into there. Certainly people can call their pediatrician or their family physician to get those vaccinations. The FQHCs, Charles Drew, One World, all have that vaccine available as well. So there are lots of different ways that you can get that vaccine right now. And we certainly recommend that people do that because it looks like we're having good success keeping that severity of illness down, which is really what we knew. We weren't going to totally get rid of COVID. We knew it was going to stick around for a while, but being able to make sure that people just don't get as sick, that it does just kind of be a mild illness for people. Seems like that's working out.
A cost issue, is most of the testing free, or do you have to go through your insurance company?
For testing?
Yes.
Another good question. So the availability of the free tests, like the free PCR tests where you go somewhere and they swab your nose and it takes like a day to get those results back. Getting them for free is more limited than it has been before. I think possibly the FQHCs might still have that, but we have home tests available for free in various locations in the community. So there are several branches of local libraries that are carrying those. And you can even come to the health department and right inside the front door before you get to the security desk, there's like a stack of them and you can just come in and grab a couple. So, no questions asked, just you can take what you need. And so we are trying to keep those free home tests available out in the community. We also are making those available to our school districts. So if they want to utilize them, certainly that's something that the families may have available. It just depends on the district. And so we're trying to get more of those free home tests out into the community so people know what their status is. If they're feeling a little crummy when they wake up and They take a test and it's positive, then they know they need to stay home and stay away from other people until their symptoms are better. And it's been at least 5 days.
Now, the president, it's very confusing what's taking place with the president. So is he vaccinated or is he doing something else? And why does he keep getting a positive test?
Yeah, that's a really good one. So I do believe he is vaccinated, but the issue that we're seeing right now, I think, is with the antiviral medication that he took.
Okay.
And we do see some cases where you get a rebound positive. What you're seeing really is like a rebound positive. It's not necessarily that he got COVID again right after he had it. It's really just how that antiviral impacts the system, the body,
Right.
and then how that test is being picked up. So we have heard of instances of that like secondary positivity that comes after antiviral. So it's not surprising necessarily, but it is confusing.
Yeah.
You hear somebody who's had all the
tests,
things, and now they're
not tested positive. So I was just wondering, maybe he hadn't took the vaccine, but it's a little bit confusing. Next question would be: is there a consistency from the WHO, the CDC, to our local office in the recommendations that each agency gives?
That would be oftentimes no. And the reason for that, there's actually a pretty decent reason why you're going to see variations between what the World Health Organization says, what the CDC says, maybe what the state and local jurisdictions say. And that's, they have to really think about the size and breadth of the population that they are speaking to.
Okay.
So World Health Organization is speaking to the whole planet.
Right.
So they are going to be recommending measures that could be appropriate in just about any setting, but may not be appropriate in all settings. The CDC is really only looking at the United States. So, they're going to be looking at a somewhat smaller population. They don't know what's happening at the local level. So in general, you might see in the United States, maybe things are going one way, but locally, very different things are happening. And so that's why our local recommendations often don't look exactly like what the CDC recommendations are or what the WHO recommendations are. We try to align as much as we can with all of those, but we really have to make local decisions that are appropriate for the people we're serving, not for, what's right for people in New York or California or, a variety of other places, because they might be in a completely different situation than we're in.
Okay. Monkeypox. I guess that's been the hot topic. What is monkeypox, and how do it spread?
Monkeypox is a virus. It is in the same family as smallpox, but it is much milder than smallpox. So we don't see people get nearly as sick as you would have seen with smallpox. So it still occurs in a similar way where you get kind of this really painful rash or these lesions. They kind of look like pimples or blisters. And the way it spreads typically is through skin-to-skin contact.
Okay.
There can be some limited respiratory spread. We don't have a great handle on that component yet, but so far what we're seeing with this current outbreak is that skin-to-skin transmission is really what's holding true in most cases for transmission. So really, if you are around somebody who has monkeypox, get monkeypox necessarily sitting across the table from them unless you're sharing utensils or cups or sitting in the same chair, or, those sorts of things. It's really that skin to skin contact that we worry about. So as long as you're not rubbing up against people who have that infection, probably you're not going to get it. Now, it does infect things like your clothing, or your bed linens, if you have that virus. So if somebody else comes along and they don't wear gloves, let's say, to change the linens or to handle the laundry, you could get some transmission that way. But by and large, what we're seeing right now is really that skin to skin contact for more than a minute. I mean, if you brush up against somebody in the grocery store, you're not going to get it that way. It's really, some more prolonged contact, skin to skin, that we see.
Okay. I know Paul got a question. I know Beth got a question. So any questions out there? Yes.
That's a really good question. I think that the evidence shows if you've had a smallpox vaccination in the last 5 years or so, that provides protection. Since we've had, different scares over time, people have been vaccinated more recently. I think there could be still a little bit of protection from those earlier vaccines. I just don't know that we have a lot of proof of that at this point. Yeah, it could. It could.
Paul?
Talking about differences in
Mortality.
maternal and infant mortality, the racial differences between. I would love to, but is there anything about monkeypox that we want to cover before I get to that question?
No, you go ahead.
Okay, wonderful. I just didn't want to break it up too much.
No problem.
So what we typically have seen, and I'm sorry I don't have exact numbers for you, is that there is certainly a disparity or a large difference between maternal and infant mortality rates between white mothers and babies and Black mothers and babies.
Interesting.
Yes. So there are a number of reasons for that, racism being one of them.
Okay.
There are a number of biases that people carry that I think impact care sometimes. There are issues with access to good healthcare services that remain an issue. There are a whole constellation of issues that really come into play with that. But there definitely is a difference between what you see in terms of those birth outcomes for white babies and birthing people and Black birthing people and their babies, which is something that we definitely need to work on. And I think I'm hearing more in our community about really addressing that from multiple angles, which is wonderful. Wonderful to hear.
Yeah. Good question. Good question. Any more questions? We'll go back to.
Yeah. So, what have we been seeing with the STDs? Yes. So certainly, our rates of infections such as chlamydia, gonorrhea, syphilis, even herpes, things like that have gone up during the pandemic, which is not. I was not surprised to see that. A lot of the services and education that people typically access to help prevent that sort of thing really went away. Everybody transitioned over to controlling COVID. And so, people didn't have as much access to STI testing and treatment. So then you have, especially those asymptomatic infections that continue to spread in the community. Our outreach people were not able to be out as much to help people learn more about STIs and what they could do to prevent them. And so there definitely was kind of a hole there, a gap there. And we're now coming back into that work and trying to catch up, if you will. But our rates certainly have gone up since.
I think a while back it was 68104, 68111 had a high degree of STDs.
Mhm.
How is that number looking now? Has it gone higher or has it been reduced?
I have not seen the breakdown of the data in the last few months. I would imagine that hasn't changed too much, given that we've seen an increase everywhere with sexually transmitted infections. So I would certainly think that you would certainly still see higher numbers there, but I don't have an exact number for you right now. But that's something we certainly can tease out.
This pandemic has shown the disparities which take place, and especially in the Black and brown community. What, if anything, your office can do to be able to alleviate that or address that in some way, shape, or form?
That is a great question. I think we make assumptions about how we can be of assistance. We make assumptions of what people need to have better services or to be able to make the numbers better in terms of infections and things like that. But at the end of the day, you all know what you need, and we need to hear from you. This is what would be helpful for us, or that messaging you're doing, that's not landing, that's not helping, and really just help us understand how we can help you better. We're here for you. We're here to listen. And one of the things that we did this past year is hire a health equity advisor, and we actually have a whole team now of health equity people who are really working to help us get our arms around the different disparities that exist. So Black, brown, LGBTQIA, whatever, men, women, wherever you're seeing a disparity in health access or in how people are experiencing disease and health, we have a team of people now who are really helping us to reach out to the community and do a better job of putting things in place that are meaningful instead of just what we assume would be best.
I love the fact that you talked about community engagement, because usually it's after the fact. We never get a chance to put our input in. Most of the time, folks who are outside our community who are making these decisions. So what are you department to make sure that you have actual community engagement from the community you're trying to serve?
Thanks for that question. So, of course, we're always learning of new, community groups that we want to engage in or engage with. So when we do find new ones, we invite everybody to the table and try to, foster input and collaboration. Through at least since I've been here, I can't really speak too much to, previous to July of last year, but we have basically a health advisory team that exists in North Omaha, and we have one in South Omaha, and we met and still meet regularly with those groups to hear their input about, okay, well, are we not reaching people because we're not communicating in a certain way? Do we need to make services, help to get services available in a certain area that maybe just is too hard for other people to access outside of that area? Or we're working with these advisory groups to hopefully hear better from the community itself what they need, and not just, again, make those assumptions about what we think they need.
So I know language is a big barrier, if you will. So how are y'all addressing the language barrier in the different communities?
Language barriers, great question. So that is kind of an ongoing effort to make sure that we're improving with that. So again, our health equity advisor is so instrumental in helping us to figure out where we might need to look at our hiring practice, or maybe we need to look at different types of services that we need to contract to help us better get over those language barriers. So for instance, do we need to hire more Spanish-speaking people in a certain program because that's where they're doing the bulk of their work, so they need to be able to speak the language? Or do we need to contract with an organization that can help us quickly turnaround translation of documents that, educational documents that we need to put out to the public. So we have several different avenues that we try to utilize to make sure that we're getting things out in the languages that are needed.
And that's one of the first questions I always ask. How's the information being disseminated into the community that you're trying to serve?
Yes.
And most of the time, people will tell me, well, we have a website. All right. Okay. And that sounds great, but you have a lot of folks from my community who don't know how to navigate, don't have access.
Yeah.
So how do folks learn about the different resources
Mm-hmm.
and the different opportunities that you guys provide?
Absolutely. We do have a handful of staff who speak fluently in other languages. And in fact, in order to utilize those services as part of your employment, we ask that they take a proficiency exam. So we know that what they're translating or what they're interpreting is more likely to be accurate. And so when people call in, if we need someone who's Spanish speaking, we have staff that we can ask. There are times we do need to, obviously we don't have every language spoken in our department. So when we do have a call, maybe that is in a language we don't have anyone who speaks, we can reach, translate or some type of interpretation service organization and use interpretation that way. But we do have people who are able to assist. If people aren't, they don't speak English, we have a form in English and they speak Burmese. That's kind of a challenge. So absolutely, we would find a resource to help with that.
And the reason why I asked the question is a lot of Mayan population, a lot of Sudanese population that come to our pantry. We have anywhere between 550, 600 people come through a month. And I don't think a lot of those folks know about what you guys do. So is there any way we can maybe get some lit that we can actually put in the boxes to about your organization and how to contact?
Is that something that we can do? So we have a number of like Sudanese, Karen, Mayan. We have a number of different languages spoken. Can we get information in written form where they're able to give that out so that they know about the services that we offer and those sorts of things? Is that something we can do?
And I want to give a big shout out to Phil Rooney. Phil Rooney has been in this community for a long time, and he really do have the heart and commitment from the community, and we trust what he says. So make sure you stay there, man.
Phil is great people, and I would love if you would allow me to introduce our health equity advisor.
Yes.
Because I want the community to know his face well. So Mr. Jamin Johnson is our health equity advisor, and he is an absolute part of our community. So can I give him the microphone?
Yes.
And if you have any, I'm totally putting you on the spot. Are you okay with that?
Thank you.
So how you doing today?
I'm doing well, thanks. How are you?
Not too bad. So talk about yourself and your role at the health department.
Sure. So my name is Jamin Johnson. I have a diversity of public health experience, and my role currently is to really connect the dots between the work that is happening within the Douglas County Health Department and then the identified needs at the community level. And really what we need to do is make sure that we are making informed decisions based off of the needs identified by the community, not us identifying them and showing up with the solutions, but us bringing the resources and tools or connecting people to those services. So like the language access question that you were talking about, we recognize that, that there are, the school district has noted that there's close to 130 languages spoken in the Omaha area. It's not possible for us to have materials and resources in all of those languages, but we need to be able to respond quickly when a need arises. So we've been working with our refugee resettlement agencies to try and identify people who can translate and interpret those languages that we don't necessarily have ready access to, so that we have that ready to go as a community resource. Some of the other things that we're doing are we are looking at those factors that impact people's ability to live, survive, and thrive. So we talked about maternal mortality and infant mortality. Infant mortality really is one of the key health indicators that the Office of Health Equity is looking at as a sign that there are disparities present within our community that need to be addressed. It's our roadmap. I'm really looking at it from the perspective of having two bookends. We have life expectancy on one end and infant mortality on the other end. Yes, absolutely.
And the infants that were tested in the group that got the money showed significant improvement in 1 year. It's going on for 4 years. But they did a study to look at brain scan and brain activity and development. All those things improved. I'm sure health would be part of that. How is that being expanded? I mean, it's like not complicated.
Yeah, I think you pose a really important point. We understand that economic disparity is a driver of poor infant outcomes. There are challenges. There are inherent challenges. We are not necessarily positioned as an agency to be able to provide those kinds of funds direct to birthing people. I would love to be able to do that. And if this study at its conclusion, if the outcomes of the study continue to demonstrate that this is a really successful strategy and an evidence-based approach to address infant mortality, I would hope that we are reliant upon, and often cases, federal funding through grants. And I would love to see a maternal and child health grant come out addressing economic disparity as an underlying cause and factor of infant mortality. And I will tell you that that maternal and child health, that's where my heart is and my passion is. And I will write that grant the second it hits the ground. But we also have to recognize that there are some areas in which we're positioned to lead and other areas where we're positioned to partner. And I would say when it comes to providing targeted and direct funding to people at the individual level, that's not an area where we have historically been very well equipped to respond. I wish that the case was different, and I would hope that the time comes where that is a case. But unfortunately, right now, I think we would have to rely on partnership with other nonprofits that maybe have the financial means to be able to do that we can support them in implementing that strategy and maybe provide some staff support to getting that rolled out. But from the funding perspective, we would need help.
Well, I think it's leadership part. It's like the Weiss Foundation got that article published in the New York Times, and then it happened in Omaha. The funding was there, and it just died. As far as there's nobody else taking the ball and running. We've talked a little bit about that, and it's not a funding thing as much as you're going to get grants. That's why the child tax credit died on the line. I think there's ways to get other funding from other organizations and other people, individuals in the community. But I think you guys have a unique role to be able to say, this is still a major problem.
Exactly.
Investment from the community, whether it be grants or individual. These mothers have $300 a month.
Yeah.
And where can we get that money? And it can come from other people, other organizations can make those contributions, but someone has to be out there saying, this needs to be happening somehow, somewhere.
I agree completely. And I think, that highlights why, this has become, for me, this is, when I talk about our key health indicators, I cannot separate out the impact that babies and mothers dying is still a reality. It's still a reality here in Omaha. It's a reality in Douglas County, and we can't allow for to be forgotten. And as a health department, we do have a responsibility to address it. We have a responsibility to speak to it, to educate people around the reality that it's happening, and at the prevalence by which it's happening, and identify the resources that already exist in our community to try and address it. So I appreciate what you're saying, and I agree. Our responsibility is pretty heavy. Mm-hmm. So I will say that that a robust nurse-led home visiting program is the gold standard. It is the gold standard, and having a universal model that does not take into account, for example, there are models and programs that are only applicable to a birthing person's first birth. Well, a birthing person that delivered their third child still may need support and assistance, and so being able to strip away those artificial barriers limiting access to home visiting programs is really important. Building in a robust nurse-led home visiting program, honestly, I think. Yeah, I'm aware of the organization. I will say that one of the areas where our agency is still trying to figure out where we can position ourselves to lead is in the maternal and child health space, and talking about the impact and the need for home visiting services. And the first step really is identifying what's already happening in our community, because the reality is it is happening. It's just the fact is we need to educate ourselves on what's going on. We bear some responsibility for not knowing, and we own that. We want to find out what's working really, really well. And that's where the community health needs assessment really comes in. We can take a targeted look at what services are already being provided, what hospital systems are engaged in this, because they have an interest in this as well, and see what programs and models are working really well for them, so that we can either move to replicate that, we can expand it, or we can say, you know what, based on the needs of the community and what we're hearing from the community, we need to make some tweaks and some changes. But your point is well taken, that I will say that it is the gold standard, and having a robust, universal, nurse-led home visiting program is what it would have a tremendous impact on birth outcomes. Yep. Mm-hmm.
Yes. Barb.
So is there a method that outreach workers can identify
That's a great question. I don't know. That is something that I will definitely take back to our community health workers and to the supervisor that oversees them. I think that, you know, they are trying to constantly glean new resources that they can refer people to, and so I will make sure as soon as I get back to the office that I pass this one along. See, and yeah, we can't separate the two. We just can't.
And Paul, you made a very good point. The White Foundation, where can you find that article that they did in New York Times?
Reach out to people in prosperity, giving from their own personal resources to an organization that's doing home visits and supporting individual moms that are pregnant. The goal is to have a network, a safety net for every baby that's born and the mother for health and keep them out of poverty to prevent these deaths. And you start when they're pregnant. And that's where the Weiss Foundation is. And I think it's worth the meeting to talk to the Weiss Foundation about what they're doing. Because truly the brain scans are different in 1 year. And the only thing that was different was the $300. So if you gave other resources like home visits, nursing, health with housing, transportation resources, the goal being to lift people out of poverty, one kid at a time. And the problem is you and I talked about the overcrowding of the prisons. If you keep trying to fix it there, you're getting nowhere. You have to go back to every baby born with a mother who's going to die early, or a baby that's going to die early, or being put into poverty, where you've got brain development being impaired in those first few years, and then exposed to trauma, violence in the community, where they may be dealing with things. Getting back to a nice contained group, which is babies and the mothers when they're being born and getting them connected to people. Donna Pope, you know Donna Pope.
Yeah, I know Donna.
She ran a program like this. I got a video of it. She ran it in 1990. But it didn't get funded beyond that. And it's like, if you get organizations like the Catholic Church, if they want to be pro-life, you invest in the baby that you were, right? That's the big thing of the Catholic Church. So I think the families of to make investments through an organization like Heart Ministry or Black United. There's every organization in town can start getting funding personally. Brian Stevenson says you got to get proximate and have those relationships and channel funding to people as an emergency resource, but then also connecting them to other resources of health, education, getting preschool, home visits, getting preschool those first few years, all those things. I've been kind of bugging people about this stuff, so I'm kind of on a roll.
Okay, and then really the elephant in the room, the Roe versus Wade. How is that going to play in this whole mix, this whole conversation? When we're talking about, they look at each other and smile.
Our role and our responsibility and our job is to make sure that the individualized healthcare needs of each person are accessible, and that's our position.
Drop the mic on that one. So, how do folks get in contact with you and learn more about what you guys do? You do personally?
Sure. So, though you addressed it, we do have a website. My contact information is on there. But then I can just like email you my contact information too, and we can get it out. So
because I think we need to see more of you, right? So we know that we got a voice or advocate inside the department. And if we have any questions or concerns,
Absolutely.
we can
Bring them
call
to
you.
me.
Yes,
Yep.
sir. All right then. All right then. You want to bring her back up or what?
Yes.
And how impressed we've been with Douglas County and meeting the needs of these people. And that means working with neighborhoods, working with churches, going to people's homes, and to other identified, community identified places to provide COVID vaccination. We are really in a dilemma in that our routine vaccinations are reduced, and that's across the population, not just in our minority population. I hope and expect that some of those same kind of learned lessons will be applied in working with that. But a lot of it has to be really getting the word out. The immunizations we have to have forever. Their prevention, because these diseases have been around for thousands of millions of years, and they come back. Measles will come back, et cetera, et cetera. But I just really wanted to congratulate Douglas County. They have done a wonderful job. And they meeting the needs of not only groups like our church groups in North Omaha, but actually individual families to go to their home, particularly elderly, et cetera.
I thank you so much for that, and I agree that my clinical team has been incredible at really not being too worried about where the guardrails are and saying, well, we need to get this out, so how do we do it? And I mean, really, from week to week, we had these pop-up clinics, that would happen really wherever we were needed to go. If we had community partners, neighborhoods, whatever the case may be, that reached out and said, we really have a need here, we would work to make that happen as much as we could. They have really worked themselves to the bone. It's been awe-inspiring to watch my clinical team do what they do. I am incredibly proud of them, and so lucky that I get to serve them as their leader. And just, I know that they're going to keep, like you said, vaccination rates are down. That was not unexpected, especially with a lot of the politics just around even a single vaccine that bleeds over. And we have people who that's their role, is to really figure out how we're going to make sure that we're getting those rates up, that we're encouraging people to get in, that people know where they need to go to get those vaccinations, that they have good information about those vaccinations. So we'll keep pushing on that, and I will be to pass your words on to them, because I know that'll mean a lot to them.
Share information about immunization rates so that we can identify, how we're doing, keep putting pressure on from a volunteer organization that's been in existence for a long time to keep meeting these needs of our community wherever the community is.
And I definitely want to make sure I reiterate that you guys have did a phenomenal job. I mean, the political arena behind all this stuff is it's kind of crazy sometimes, but y'all kept the focus and you kept the mission in mind, and that is to serve the community. So big up to Phil, big up to you and your staff and the job you guys are actually doing. So I wanted to make sure that we get you here to learn more about what you do, but more importantly, what we can do as a community to support you in your efforts. So
Let us know what you need. I mean, we can't do everything. Wouldn't that be nice? If I could find a few $1 million more, even, that would be really fantastic. We would love to do everything, but we will do everything that we can. And we don't know what that is necessarily if we don't have input. And so we really want to partner with you and just know We just want to know, what is it that you need? Ma'am, yeah. Yes, you can. So her question for those who didn't hear is, if you've caught COVID and you've recovered, can you catch it again? The answer, unfortunately, is yes, you can catch it again. So you will have some protection from that for a few months. Essentially, the immunity in your body stays in place for a few months from having that natural infection, but then that immunity starts to decrease. And so if you're exposed again, especially if it's a different variant, so one of those that just, it's still COVID, but it's just genetically different enough that your body thinks, oh, this is new, you absolutely can catch that again. And that's one of the reasons that we really recommend that people be up to date on their vaccines and boosters, because while it's still not permanent immunity, it gives you much longer lasting immunity, especially with those boosters. So we really recommend that. Yeah.
So should we be wearing masks now? I see about 3 or 4 people with masks on, and I want to make sure that I'm being safe.
Well, there's no mandate. However, we are in the high. We just moved up into the high transmission category.
Okay.
So wearing a mask when you're out in public and you're not able to stay 6 feet away from other people is a really good idea.
Okay.
Especially if you're, I mean, anybody should, but if you're high risk, especially. So if you're somebody whose immune system doesn't necessarily work real well, and you are more susceptible to a severe illness, we really want you to protect yourself with those masks, just so that you don't end up in the hospital. And of course, with vaccinations, that gives you some extra protection. So right now, it's, everybody feels a little bit differently about them. And I certainly do recommend them at this point. As we move back down the risk levels, I can back off on that recommendation a little bit, but absolutely, it's a really good idea right now to wear those.
And I hate to put you on the hot seat, but it is what it is. When you initially extended the mask mandate, after seeing the blowback, do you have any regrets, and would you do it again?
I don't have a single regret, and I think that it's very easy to make a political decision. It's hard to make an unpopular decision, but sometimes that's necessary to make sure that you are doing the most good for the most people and protecting your, what people don't always realize is that, it's a hassle, but you're not just protecting individuals, you're protecting your economy because people are healthy enough to go to work. Mm-hmm. You're protecting your healthcare system because people are healthy enough to take care of you when you are sick, and they have fewer of a certain kind of illness, COVID, to take care of. So would I do it again? Yes, I would. And I'm not afraid of the hot seat, so it's all good.
That's us. And then diversity and inclusion. They throw those words around a lot. What are you inclusive of people of color to work at your department and in your community?
That's a great question. That really starts out with setting the tone of inclusion in the actual culture of your organization. So making it very clear that discrimination has no home in your organization, which I think from day one, I've been pretty strong on that. Some people would definitely tell you that I've been very strong on that. There is no place for discrimination.
Right.
We want everyone to feel welcome and like they can show up as themselves when they come to work. Right. We also are, we look at our hiring panels. We try to make sure that we have a mix of people on our hiring panel. So it's not, 4 white women or 4 white men, or, we try to make sure that we're mixing up as much as we can on our interview panels. We're making sure that we are getting input from people who, the diverse people we have in our department, and really listening to what they have to say about how the culture has impacted them, what they what is it that they need to feel like they can show up at work and be who they are. They don't have to make their hair a certain way. They don't have to look a certain way. They don't have to present themselves as a certain type of person. They can come as who they are, because they're part of our community, and that's who we're serving. So our organization should look exactly like our community, right?
Yes.
Yeah.
So, have you reached out to Senator McKinney and Juanita Johnson and Senator Wayne to be able to talk about some of the era funding that could be made available to you guys?
So we have worked with Senator Vargas, who was actually able statewide to secure extra ARPA funding for the health departments, which is great. I am always, in fact, I can't say a lot now because things are very much in their planning stages, but working on a couple of different, hopefully a couple of different funding strategies that can help us maybe address some of these gaps that we have that, we don't always have the grant money for, or you get the grant money and it's great for like 10 years and then the grant money dries up and you have to scrap an entire program. So we used to have a nurse-led home visiting program out of Douglas County Health Department, and we had some other resources in the community that I think those tasks kind of went out to, but we didn't have the funding to keep it going. And so now we don't have it.
We got to make sure we get you some access to funding. Kenny, especially when we're talking about the impact on our children and our children's health, that would be something that he would definitely want to be at the table with. And I think it would definitely be open to doing funding. So he's on my board, so a good friend of mine. So
well, I am happy to talk to anybody who will let me talk.
Well, like I said, I'm gonna be holding some meetings, and I think it'll be a good fit. Maybe you come down, talk to our group, as well as Senator McKinney about
anytime
doing some of those things. And secondly, I want to thank you so much for bringing the gentleman right here to the group. It's always good to see folks who look like me. All right, disseminating the information into the community. So, big ups, and anything I can do to help you with that mission, I'm definitely open. And so we had about 3 minutes. Phil, you want to say anything? You want to say anything? Maybe give your email address or contact information?
Oh, do I want to give out my email address and contact information?
No, you probably won't just give the website.
My email address certainly is fine. It's lindsey.hughes@douglaskounty-ne.gov. Yeah, I get a lot of emails. I cannot promise that I get to every single one, but I try.
No worries.
Yes.
Well, we want to thank you so much for coming down and engaging the community and regarding our health, and especially about this situation where a lot of folks are conspiracies and things. But it was a pleasure getting you here.
Likewise.
And learning more about yourself.
It was an honor, and I just so appreciate the invitation and very grateful to get to come talk and to bring Jamin and put him on the spot. He's usually so great about things like that. So thank you, Jamin. He's here to make sure that our diversity work is not a box to be checked. So I like dragging him around with me.
And lastly, we are doing an event on August 14th. We're looking at about 1,500 book bags, supplies giveaway, back to school event. It's going to be held at the Bryan Center. Us, BAA, Untamed, and Tomika. So, positive, productive Black fathers. So it'd be a great opportunity for you guys to come down. That's our lit, and then meet a lot of the folks that's there.
Yeah, send us the information.
Definitely do. All right, then. We want to thank you so much for coming down and joining us at the Hungry Club, and we hopefully see you next month. Thank you.
Hi, welcome to Big Mama's Kitchen and Catering. We've moved to our new location here at the beautiful Highlander Accelerator Building located at 30th and Patrick. We are still open even during the pandemic. We've made some changes and we are here to serve you Omaha's best soul food. The best way to order Big Mama's delicious soul food is to go to our website, bigmamaskitchen.com, click on the Order Now button, Place your order, pay for your order, and upon arrival, park at any one of our 4 convenient curbside pickup locations. Give us a call and we'll bring the order right out to you. You can also order carryout from Big Mama's. Park on the Patchett Street side of the building, walk down this long brown sidewalk, and come in through the west doors. Once inside, you come in through the door and enter in what we call the dining room, and you walk right up to our window and you can place your order or pick up your food. We're looking forward to preparing a fresh home-cooked meal for you, and we hope to see you soon.